Unmuted.
Hey everyone, how you doing today? Kyle Swinski here from AM Opportunities. Just wanted to give you a warm welcome. So we got a good agenda today. It's the first time we're actually going to have some financial training from BMO Bank. Hopefully that's helpful for you guys. It's going to be exciting. As always, thanks so much for choosing AM Opportunities. We're always happy that you're joining these sessions. These are really helpful. I know that some students in the past have missed the pre-departure training, and they miss out on some things because it's important to know what to expect when you arrive. And one thing we always say is you can post your questions in the comments in the chat, and we'll answer those at the end of the session. But as always, thank you so much for being here today. And I'm gonna pass you on to our first session with Ryan here. 1 second.
Hey everyone, Ryan Flores here. I just want to go ahead and, like Kyle said, thank you for joining us, and most importantly, thank you for choosing AM Opportunities for your clinical rotation. Today I am going to touch base on arriving in the US and preparing for your rotation. So first and foremost, I believe most of you will be arriving a few days before your rotation begins. That is great. Do make sure that you look into international cell phone service in the US. We do want to make sure that you have data and mobile use while you are on your rotation and while you're here in the US. This will be very important, communicating with us, communicating with the doctor and their staff, and also very important in case there is an emergency. So if you have not looked into that already, I recommend contacting your mobile carrier or emailing myself or Kelly, and we can point you in the right direction. Also, at most US airports, you can buy a mobile phone and a data plan that is pretty inexpensive. Again, if you have any questions, let us know. Also, regarding your arrival to the airport, transportation, I would recommend a taxi or possibly a ride-sharing service like Uber. You can find information on that at the airport. Taxi stands are generally very accessible, and there are informational guides to help you. Again, like anything, if you have questions, reach out to myself, reach out to Kelly, and we'll be more than happy to help you. Now onto your rotation. We do recommend that everyone arrive at 11 a.m. on your first day. You can arrive to the reporting address that you've received on your enrollment notification. If you have not received that enrollment notification or you've lost it, no need to worry. Email myself, email Kelly, we'll get you that right away. So on your first day, when you do arrive, make sure that you go to the reporting address. You can introduce yourself to the staff. Let them know that you are there to shadow or rotate with your doctor, and they will make sure to put you in touch. If it's a little busy or the staff seems confused, do not worry. Wait patiently, contact AMO, and we will reach out for you so you can get straightened out. Also, I almost forgot to mention, if you have received other starting information from your doctor directly or from AMO, do follow those guidelines. If you're confused or you have questions, just let us know. And then I do want to touch base on transportation to and from your reporting address. I do recommend that you look into that now if you have not already. And if you have questions, email us. Google Maps is a great resource to figure out public transportation. If you are able to rent a car and you choose to do that, make sure to look into that information. And then if you have about parking at any of the facilities, we can reach the doctor for you and help. So it's your first day and you're arriving, and what should you bring? The nice thing is AMO has already sent all of your information over to the doctor. They are expecting you. They should have also passed your information to the staff so that they are aware that you're joining. Otherwise, you can bring a notepad, writing utensils, a stethoscope, and a white coat. Now, you may be asked to bring or not bring other materials on your first day, so just ask the doctor and they will help you with that. Lastly, I do want to touch base on dress code. So for dress code, you should always dress in a professional manner. Remember that you are a representation of your school, your country, and your university. So we recommend business casual. And with business casual, make sure to try to avoid jeans, gym shoes, and t-shirts. Dress to impress. That's going to be best. Also, do be sure to practice good hygiene. Shower before your rotation and after each day. You do want to as well keep fragrances and perfume minimum. And if you're in a location where the weather is still kind of transitioning between spring or winter and summer, make sure to bring sweaters, gloves, hats. Just think of your commute and the time that it's going to take you each day and dress appropriately. Most doctors' offices will have place to put coats and boots, so don't be afraid to bring those to the clinic. And I think that is all that I will touch base on today. And I want to pass you along to Ben Bradley, and he's going to discuss letters of recommendation and some other good stuff that you're going to have many questions about. And continue to write your questions in the comment field. We will be sure to address those today. Thank you, and enjoy your experience with AM Opportunities. Take care.
Hi guys, if you probably have spoken with me before, but if you haven't, my name is Ben Bradley. I'm one of the co-founders. I'm going to talk to you about basically setting your expectations, what to expect. We have two different types of programs here, some for graduates, those observerships, and then the hands-on rotations, which are your electives and that sort of thing. So really quickly, I think it's really important that you understand for whichever rotation you're in, whichever rotation type, there's certain activities you should be doing and certain activities you should definitely not be doing. So the easiest one to explain is the observership. So in the observership, we like to call it hands-off. A physician may allow you to, use your stethoscope or something like that, but generally you're not going to be involved in patient care. What you're going to be doing is participating in your normal question and answer, your differential diagnosis. Physicians are going to be, speaking with you, testing your knowledge, asking you about, case presentation. So it really functions similarly to your grand rounds type situation. You're just not going to be doing any patient care, and this is for legal reasons in the United States. We really want to make sure that if you're doing an observership and you're a graduate, you don't introduce yourself as a physician, and you don't do anything that could be considered the unlicensed practice of medicine, because this can, not only is it a crime, it can hurt your chances of getting a visa for residency and your ability to practice in the United States. So if you have any questions about that, you're a little confused, send it in the chat or send it to the support email or Kelly, and we'll get you some answers. Now for the hands-on rotation, those of you in medical school, the hands-on is going to involve kind of the non-invasive activities. So this is taking histories, keeping notes, case presentation, differential diagnosis. You may be assisting in some non-invasive procedures. All of that is really good, but still you want to make sure that you do not introduce yourself as a physician, introduce yourself as a student. It's really important, again, for residency and visas. Now, the one thing we've gotten questioned about in the past is, well, what if my physician says, I should do something and I think it may be outside of what I'm supposed to be doing on an observership. Let's say your physician says, oh, I'm going to assign you to some patients and you go take care of them. You should not feel bad about saying, hey, I'm not sure if I'm allowed to do this. Let me speak with AMO and I'll get back to you, and we can talk about this tomorrow. Your physician will understand. I mean, they've been in your same place where they're trying to get into residency. They know that you're very concerned about your career and your future. So if you're ever unsure about what you should be doing, it's better to just be safe than be sorry. And then, I guess overall your behavior and what to expect. We understand for some of you that this is your first time in the United States. It could be overwhelming. I really advise you to use us and use your physician and use the office staff as a resource. Ask questions. It's better to ask questions than to be silent. And that all really plays into your letter of recommendation down the line. I would say be open-minded. The culture is going to be different. It's very diverse here. But the key is to just communicate with your staff, be professional in your communication with the staff and the physician, and then just to have overall professional behavior. Try to be on time as much as possible. If you have to miss a day, let your physician know or the staff know, preferably both in advance. And if you're running late, Ryan talked about exchanging phone numbers with the physician and the staff. Please do notify the physician if you're running late or you can attend via phone. They really appreciate that. It's considered normal professional behavior here. And all of this goes into the letter of recommendation you get and the quality of it. So moving on to letter of recommendation, this is the thing we get questions about the most. The main thing everybody should know is that every physician that we work with does write letters of recommendation. Now, because of ethical reasons, we say we will not guarantee that every student must receive one. However, I would say 99%, almost 100% of students do. Probably less than 10 out of the thousands of students we've helped. And because of this, rather than getting just a standard letter, your physician, if they like you and they like your professional behavior, even if you're not very knowledgeable, you're early on in school, if you're professional and you ask lots of questions, they're going to write a really good letter that's very personal, and that letter goes very far. I'm sure most of you know this, but the LORs are a requirement for residency. Different residencies have different amounts of LORs they need, different amounts of months. The key is it comes down to your physician's credentials. So if they're from a good hospital system, that's really going to help you in your residency. And then also the content. So like I said before, a personal letter of recommendation that speaks to you, individually rather than just a simple letter with no unique characteristics is going to help a lot. So for writing your LOR, who should you ask? When should you ask? If you're going with a physician direct program, so these are the programs where you're following and attending in the outpatient clinic, maybe you're doing inpatient rotation as well, that physician is going to be writing your LOR. For some of you, there are direct hospital observerships. Just to be clear, in those observerships, you'll be likely with many different attendings, many different residents. Often it's the department, the administration who will write the LOR, and they'll do that by getting the notes of all the attendings you worked with, putting them together, and then the letter would come from the residency, the program director. So if you're nervous and you feel like you're not getting enough time with any one physician, just be as personable and professional and put a lot of effort into your interactions with all the physicians. In terms of when you should ask, so if you're with a direct physician, we like to say ask as early as you feel comfortable. That means, if that's after the first week when you feel like you've already got to know the physician, you can tell them, hey, I'm looking for a letter of recommendation out of this. I want to use it to get into residency. What do I need to do to get a good letter of recommendation from you? And, physicians, they'll tell you what they want. You should not be afraid to ask for feedback. If you feel like you're unsure what you're doing is correct, the overall guide here is ask your physician more questions rather than be silent. We really recommend that you do not wait until the last day or even the last week to tell your physician you want a letter of recommendation, because you may have to be tracking the physician down to get it. We do that. We help students that need that years on down the line if they can't get a hold of their physician. But it's best to just say it early and get that out of the way, so they know on your last day what you need for residency. And I think the takeaway here is you shouldn't really be worried about the letter. You have no reason to be worried if you say what you want early enough in the rotation where you feel comfortable. You ask what you can do to earn a good letter, and then you follow those instructions and act professionally. Make sure you treat everybody in the office, even the front, every single person, even the cleaners and the janitors, treat them with respect. I'm not sure how many stories you've heard, but I've heard many stories about people losing residency positions because during their interview they were rude to the desk staff. So it's really important all those people talk, and if you're professional and courteous and engaged, you'll be able to get a great letter of recommendation. So that's it for me. I'm going to pass it over to Kelly, who you've probably all been speaking with. She will be talking to you throughout the rotation, and she'll have some points for you here. So thanks, everybody, and enjoy your rotation.
Hey everyone, this is Kelly. I apologize for the slide mix-up, sorry. I have had the opportunity to speak with many of you. I'm really excited that your trip to the United States is right around the corner. Just want to remind you that once you are, in the States and you are starting your rotation, that doesn't mean that we are no longer here to support you or to be part of your experience. So please continue to reach out to me. Let me know how things are going, especially if you're having any issues at all. If you have concerns about your experience, if you have concerns about the things that you are doing, you feel that the program itself isn't what you expected, please reach out right away. We do want to make sure that we can get anything straightened out for you and make sure you do have that best possible experience. We will reiterate this again before the end of this presentation, just to make sure that you really remember we are your biggest advocate and we are here to support you. So please don't be afraid to reach out to us. As far as reaching out about potential negative things that are happening, the same goes for positive things. So I'd love to hear from you if there's anything that you're doing that you feel has gone especially well. If you have traveled around in the city that you're visiting and anything, found anything that was really great, any of your favorites, please send photos. Please send a little blurb over letting us know what that was. We'd love to see that in our office. We'd also be able to share that with other visitors. Once you are done with your time in the States, you will receive an evaluation. So please make sure to fill that out. It's very important. Feedback is valuable for us. And then once you complete that, though, you will receive a letter of completion from us. And know that if you have already asked that. So want to make sure that you will receive that, and that is different than the letter of recommendation. Finally, don't forget to tell your friends, family members about your experience. Get them involved. We'd love to have them join us here for a rotation in the next couple of months. So with that being said, I'm going to pass you back over to answer questions. I know we've received a number of questions prior to the orientation starting, so we will cover those. And then we will also cover questions that are being typed into the chat box. Thank you.
Hi, everyone. So, like Kelly said, we're going to skip the financial training for today because we're having a little bit of technical difficulty on that. So I'm just going to jump in and answer some of your questions. But first, a couple points. One thing Kelly said was about feedback and reaching out to us. We've had rotations in the past where students felt like they didn't want to say something to us, maybe because like there's another student in the rotation and they're being unprofessional and they didn't want to bother us. We're going to be in the office ready for you on Monday, and we really want you to reach out to us as soon as possible if something's wrong or if something's great. If you have any questions, reach out sooner rather than later. We're not able to solve any problems or work anything out for you if we find out about it in the last week. So earlier the better. Question about reporting time. For the reporting time, the reporting time is 11 o'clock unless you've received a specific reporting time in an email. So our overall general reporting time is 11. However, some physicians request that you're earlier or you're later, whatever it is. So if you have any questions about that and you received an enrollment email, a specific reporting time, you should go in at that point. If you didn't, go in at 11. Questions, just email Kelly and she'll get that answer for you. All right, so we have some questions about LORs. We talked about that a little bit. If you have any more questions about the LOR, just email Kelly. In terms of scheduling, your schedule should be on your program page. And on the first day, I think we covered that as well. But if you have any question about schedules, for a specific program, please let us know. Again, they should be in the program listing on the website. Functions of an observer, we got some questions about that. Locations. Okay, so some physicians have multiple locations in their program. You should arrive at the reporting location on the first day, and then if your program says you need a car or need public transportation to get to the other location, you do. You should probably not ask the physician for a ride. Some rotations the physician is willing to drive students. In those rotations, it won't say car required or public transportation required. So if you have any questions about commuting to the second location, please let us know and we'll check with you and check with the program and get some more clarification on that. So overall, just lots of questions about reporting site. Reporting site is the address you got in your enrollment email. I know some of you have not received that full enrollment, and that's because we switched to a new system where the doctors are still trying to figure it out. But just know, everybody here, if you received an invite to this, we've got your documents sent over, and your reporting location is just the primary location on your placement letter. If you have any more questions about that, please just email Kelly and we'll get you that information. So for short or long white coat, I don't think physicians are really going to care. I think that any white coat is good. Some physicians on the first day, you may bring a white coat and they say, well, we don't wear white coats here. But it's better to be over-prepared on the first day than to be under-prepared. So if you got, whichever white coat you prefer, if you're in, for instance, in the South, in Florida, or even in Washington, D.C., where it can be very hot, you may want a shorter white coat. It really is up to you, so whichever you prefer. So about boarding limitation workload. Okay, so for workload, the scheduled hours in the program are the amount of hours you're going to spend. You may spend a little bit more, you may spend a little bit less if there are fewer patients. A lot of workload depends on how many patients are coming into the office, things like that, but generally it follows the schedule. I would expect while you're there in those hours that you should be prepared to work the entire time except for maybe a break for lunch. You may have more work or less work depending on whichever rotation you're in during those hours, but when you see those hours, be prepared to work for that time. So we talked about kind of the clothes. We got a lot of questions about instruments to bring, stethoscope, bring on your first day, and a notepad and paper. Maybe if you have your phone, make sure you only use your phone when the physician says you can. One surefire way to not get a good letter of recommendation or not get the letter of recommendation is to be using your phone when you're supposed to be working. So please make sure when you have your phone, only use it when you're not seeing patients, when you're not busy, or if you're using it as a resource, for instance, a medical dictionary, that your physician is okay with that. Question about the enrollment email. So as I said just before, with our new system that we're moving to this month, it requires the physicians to do a little bit of work to actually move the student to enrolled rather than the old system. So as I'm sure you'll find out very soon, physicians in the United States are very, very busy, and your enrollment email should be coming probably by the end of this week. But if you're in this meeting, just know that your documents and everything have been sent over, and your reporting address is on your placement letter. If you have any more questions about that, please do email Kelly, and we'll get you that specific information for your program. So in terms of other students at the location, it really varies program to program. The most we generally have in one location is 4 or 5. Some of you will only have 1. If you want to ask about your specific program, again, just email Kelly or support, and we can get you that information. So general question about holidays and meals. So not included as a standard thing from our programs at the hospitals. However, there are certain physicians who do take their students out to lunch. I would plan to purchase your food for the entire time while you're there. And if you're staying with a host or you're staying at an Airbnb, you can ask them where to find a grocery store to buy food to cook with or anything like that. If you have specific food that you like to find or you have dietary restrictions, email us and we'll do some scouting for you and find some locations around your housing where you can buy that food. For holidays, so religious holidays, if you'd like a religious holiday off, it's just really important to communicate that to your physician and the staff early on. So you get there first day, introduce yourself. You'll probably go over some onboarding and some procedures, getting your badge. Tell the office administrator, tell the physician early on that, hey, I'm going to be out for a day for a holiday, religious holiday. They'll definitely understand. It's just you want to be very clear, early on. So in terms of just bringing stethoscopes and things like that, there may be certain rotations where you're not going to use it. We just like to say always be over prepared rather than under prepared. So bring a bag with your stuff in it, and you might get there on the first day and the physician says, oh, we don't need that. Well, that's good. You don't have to bring it the next rest of your days. But it's better to have that and then be there and told you don't need it anymore than to get there the first day and the physician says you're underprepared. It's not starting off on the best foot. So it's better to be over prepared on your first day. So for inpatient, for hospital time and IDs, if you filled out hospital paperwork, that hospital paperwork was for getting your badge and your IDs. So if you have any specific questions about that hospital, please do email us at support. Again, another question about reporting time. If you haven't received a specific reporting time, you report at 11 a.m. Okay, so in terms of activities, so there's questions about presentations, papers, any interaction. If there's like outside, papers and presentations, it's likely that it was listed in the program description when you applied. Some, physicians may, if you want to do a presentation or something like that, do some research. Just tell them early on, and they may be able to find you something if it's not something they normally do. But generally, if you're doing a presentation or paper, or you're doing grand rounds with residents, it should be listed in the program's description. Question about EMR. Generally, we say we do not want physicians to have students enter things into EMR because of legal reasons and liability reasons. It becomes, it's a situation where you can endanger any future residency position. That being said, there are certain programs where EMR access is allowed. The key is you just have to follow their guidelines and do all of their orientation procedures on site. They'll have that information for you on the first day, but I would not expect 100% to use the EMR. That's why you bring your notepad and your pen, and when you're in there with a physician and they've got the EMR open asking questions, you're going to have access to the physician's information, things like that. One more thing. So about attitude and just developing the relationship. Really, attitude is all about asking questions, being on time, being professional. It's better to ask questions than to be quiet. Try not to be rude. Don't demand anything from the staff. You are at the bottom of the totem pole in the clinic. Even the staff members there are some staff members who probably worked at these places for 20, 25 years. They've seen a lot of medical students, residents, things like that. They have a lot of influence, even if they're just somebody who works at the front desk. So the key to really developing that relationship is to just be professional, be open-minded, realize that you're on the lowest ladder, so do everything you can to be a good worker, and when your physician says do something or the office says do something, do it and do it professionally. In terms of books, if there's a required book, it was in the program description. I think just generally, you can brush up on, if you're doing a neurology rotation, there's neurology study guides out there, for steps and things like that. Just brush up on that. In general, don't think that you have to have any book unless your physician says, bring the book, and we would have put it on the program description. Any stuff you need to bring there or to buy. So the things that we talked about earlier, the clothes, professional clothes, stethoscope, notepad and pen, cell phone that works in the United States, and data, that's really, really, really important. So make sure your cell phone is going to work in the United States. Check with your cell provider. You'll probably need to buy food. That's the one thing that you're going to need to buy. And then if you're in a place with public transportation, you may need to buy a public transportation pass. If you're not sure how to do that, it should be pretty easy when you get to the station, but we can also give you some details. So just email Kelly or anybody on the team. So in general, we had some more questions about reporting time and location, but your reporting time and location are on your enrollment email, which if you haven't received, you'll be receiving shortly. It's 11 a.m. unless it says something in that email. And the last question was if you could meet anybody from AM Opportunities. We would love to meet all of you. Unfortunately, we're in Chicago, and all our students are spread, I believe, around about 50 locations this month. So if you're in Chicago, reach out to us, and we'd be happy to meet. Otherwise, your clinic staff is going to be really helpful. Your physician is your supervisor. Listen to them, rely on them, ask them questions. And if you have any questions that you don't feel comfortable about asking them, please do ask us. I mean, we're here for you. We're at the phones, we're at emails, and we'll be ready to help as soon as you contact us. So for surgery, this is a great question. So I would bring a pair of scrubs, but there should be scrubs to purchase also, either at the hospital or they will point you to the supply store. I think it is nice, to come prepared with just one set of scrubs. And like I said, get that backpack, fill everything up on the first day. You may not be going in to observe surgery in the OR the first day, but it's good to have it there rather than not have it and have to borrow some scrubs or something like that. So I would bring some scrubs. And so how do we refer to this physician? So you just refer to the physician as doctor name. Let's say, if I was a physician, I'm Ben Bradley, you would say Dr. Bradley. That's it. But just while we're talking about referring to physicians, I want to, emphasize again, when you're introducing yourself to a patient, do not call yourself a physician, even if you are a physician in your home country, because even though you have a medical degree, you're not a physician in the United States until you've gotten boarded in the state that you practice. So even though you're a physician abroad, you're not a physician in the state of New York. So say, hey, my name is Ben, I'm a medical student or recent graduate here to train. So where to meet the physician? Go to the reporting address. Tell the front desk person you're there for rotation with the doctor, and they'll point you in the right direction, or the physician will be waiting for you. Again, just the reporting address at the time. Go in and introduce yourself to the person behind the front desk, and they'll point you in the right direction. If you have any questions about that, again, for your specific program, just email Kelly and she'll get you that information. All right, well, I think that's it. I want to thank everybody for checking in, and we're really happy that you're coming to the U.S. We're happy that we can be a part of your journey to becoming a physician and getting into residency. We have one more question. So dietary restrictions. The issue with bringing food from home is if you're coming from outside the country, you have to go through customs, and then you have to declare certain food. So if you have dietary restrictions, it's probably better to tell us or tell your host, and they can suggest some places, some stores for you to go around your housing. In the United States, we've got people with all types of dietary restrictions, whether it's religious, lactose, dairy, vegetarian, vegan, fish, anything shellfish. We all have that. There are people with that the same way. So if you're ever at a restaurant or you're at a cafeteria or something, you can ask the staff, hey, do you have, any halal options or, kosher options or vegetarian options? And they do have lots of, choices for people that have restrictions. But again, I would probably stay away from bringing food in through customs just because it's a big hassle and you have to declare it. And, that's just another thing you have to deal with at the border. We want to make the border entry just as simple as possible for everybody. So again, if you have questions about dietary restrictions, just email us, email Kelly, and we'll help you out. So I think that's it. We did record this. Oh, wait, sorry, I'm just calling down. So if you're in the U.S., you can bring food. Definitely. And also, okay, we have one more question here. Can the doctor upload our LOR directly to ERAS? Yes, they definitely can. We know that that's the way they have to do it. So just, let the doctor know, again, you're trying to apply to U.S. residency. You want to earn a letter of recommendation. How can you earn a letter of recommendation? And, can they upload it to ERAS? If you're with a physician, chances are they either used ERAS to get into residency or they have uploaded letters into the match for other students. So they're familiar with it. And, obviously if they have any questions or if you have any questions about that, once they, we're here to help. We've helped students get their letters uploaded, the day before the deadline. So they are there and they're familiar with ERAS. But I think that's it. We did record this. I will also say that we are going to reschedule the financial training, and the reason that we are doing the financial training for everybody, for those of you in the United States, it may not seem necessary, but we've had a lot of students come in the past who just keep all their money in cash. Under your visa, under the B1 visa, you can open a bank account, and we really, really recommend that. So we're going to have this financial training to kind of introduce everybody to the banking system and how to do that. We'll reschedule that for you. And then again, any questions, email Kelly at aimopportunities.org. I'm sure you've all received emails from her. So, looking forward to your rotation, and send us pictures. Thanks, guys.